12th and final cohort for the year, or for the unwinding period. If you go to the next slide, please. And this is a slide directly from our state covered RI website. So this is available to everyone. It was updated just the day before yesterday for everyone's edification. That is updated every 2 weeks. What we don't have yet is the analysis of the November data. November closed out on the 30th of November. So that cohort will have that posted on the next update. But with this data in front of you right now, as you can see, what we've done is 124,000 plus renewals to date, with a average of 50% or better with our passive renewals, which is very good, probably one of the highest in the country. And the takeaway from this would be we are on track. We have met our goals for those months. We started out small. You'll see these as we go through the months, the case or individual and case count goes up. That was planned with a hold during the open enrollment period, just maintain steady state, and then we'll continue to rise with our case counts to finish out with the last 3 cohorts before we close the unwinding period. Next slide, please. So a lot of you asked for a little bit more detail breakdown in the overall renewal data. So the takeaway from this slide is very, very promising. This is all of our redeterminations through today, with 124,057 as the stated number. That number fluctuates based on the day, but as you can see, 6% of our renewals came through packets received back to DHS for processing. 47% overall, and we'll break this down in a little bit. 40% overall for passive renewals. We have a 24% procedural termination rate. That sounds a little ominous, but overall in the national aggregate, we are right on track. And those are being processed. We're doing, basically what we're doing is every opportunity we have to avoid a procedural termination, we're using it. And more of that will come out in a little bit. 18% were incomplete renewals, where DHS did not receive all of the documentation back that they had requested. And then 5% were determined ineligible, which is a very low number. Next slide, please. And here we're going to break it out. The only way we could actually try to break this down into a little bit of a more granular demographic was by language spoken, language indicated on a person's profile or on their renewal. And what we tried to do was show this in a graphic format so that people could understand where we're coming from. If you look, none of the numbers look all that different as you break it down by subcategory. Language not provided being just a non-choice of not choosing a preferred language on your profile or on your renewal. But if you look across the board, the numbers are very, very similar, with a 40+% passive renewal rate. The number of procedural terminations remain plus or minus 4% as you go through the different groups. So really, overall, we're very happy to see this, that there's no discrepancy across the board in terms of, or any non-equal numbers showing as we go through the renewal process. Next slide, please. And this is a really great news story as we go through the households with children. We start that renewal process. Our first month, we had an 80% passive renewal for households with children, which was great. And you can see the numbers there. I'm not gonna try to read all those numbers out to you, but you can see the number of cases that will be coming forward with those cohorts. So the January cohort, those that will be renewed in their renewal date is January 31st of 2024, received their renewal packets starting December 1st. They were mailed. And with that, when we ran the numbers, that was an 80% passive renewal rate. We expect to see that remain the same across the remaining months. And next slide, please. And some had asked for this, and this is, again, will be available after the brief. We'll make sure these slides are available to everyone. who wants them. This is the numbers of children enrolled in Medicaid by municipality by number. This has been asked for before. We wanted to provide this to you and show you where, graphically on the map to the right, where the larger populations are. And it should be no surprise to anyone. And I believe with that, I will open it up. I think we're going to hold questions till the end, but I will be on till the end to answer any questions. And I'll go to the chat now to address any questions that have been asked in that forum. Unless anyone has a question that can't wait.
You do have one question in the chat that asks, that's from Jody DiBernardo, and she's asking if you procedurally terming anyone for returned mail of a passive enrollment letter. Jody, can I bring your voice to the space and allow you to ask the question in case I read it wrong?
Yes, of course. Can you hear me?
Yes.
Sure can, Jody. Go ahead.
Yeah, so I know that procedural terms are happening. Some procedural terms are because of returned mail. Maybe the member never received their letter. But I'm just clarifying, if you sent a passive enrollment letter to someone and it came back as a bad address, are you procedurally terming them even though they're passively enrolled?
No, if they're passively renewed, their coverage continues.
Okay, thank you.
You're welcome. That was an easy one.
Yeah.
You guys are going easy on me today. Heidi, I see your hand up.
Yeah, hi, I'm home now. I didn't get to, I heard you, but I wasn't able to see when you said something, you showed that graph about, was it the statistic or data about, was it ages or cohort groups or what was it?
It wasn't ages, it was by language.
Oh. And you had said something, it was even across the board or something. I don't know. I didn't hear that. I didn't understand what you meant.
It was plus or minus 4% across the board. So there's no, we saw no actual large variation based on language. And that was one of the only discriminating data fields we had to use.
So my understanding, there is a way to get age, and we've been asking for that for a while because we know some of the older folks just don't have the access like some of the younger folks do. And
we will have that for you next time, Heidi. We are working on that.
Okay.
Reason being is we're looking at, we needed at least one more month, because once we turned off the asset verification requirement, that changed the whole dynamic. So we want to have an actually valid data set to provide to you. So probably by the next advocate forum, I'll have those numbers for you. You
turned off the resource limit?
The financial, the asset verification system? Yes. Oh. That's been turned off. I'd have to ask Anthony exactly which month, but that has not been used for a hot minute.
Okay, and then just wanted to make a comment, and I'm sure you guys are working on this, but I'm just concerned about all the kinship caregivers that are taking care of their kids since COVID, or grandkids or whoever, nieces, nephews, that they're not going to get those letters because those kids have moved or those people have moved. And I just want to protect them in a way so that, you know, they're more likely to fall through the cracks quicker because we're not sure where they went. And I think it's a large number.
Well, that's been our communication team's focus from the very beginning, even before we started the unwinding period, Heidi, was please provide us with the most up-to-date address, contact, phone number, email, and we contact across all modes that we have available to us. I can't see an answer to that dilemma unless they assist us.
It's just that some of the caregivers just got these family members and had no background, had no clothes, no nothing. So some of them will really be in the dark. I'm suspecting, because some of them are just trying to survive on their own. So, and I know we've talked about this in the past, and I don't think it's possible, but if there's like a grace period beyond just worrying, you know, because we're talking about kids here. I know you have the 30-day appeal, but if there's any other grace we can give, have you guys discussed that? For those
not to my knowledge, Heidi, that has not been brought up. We're doing everything. And I mean, the focus is that everyone maintains their Medicaid benefits if they're eligible. and children even more so. So, that is not something we've talked about, but we're doing everything we can possible to make sure that they do receive the information. They are assisted with their renewal process to the best of our ability. I don't know what else we could do unless they raise their hand and tell us that they need help.
So to that
Thank
point,
you so much, Heidi, for your questions. We really want to make sure that everybody gets the information that they need in the forum for people that have to leave early. So we will open up the floor for conversation and dialogue. So this space is just to ask any burning questions that you might have that's related to these slides. But we really want to make sure that everybody gets the information that they need and can hang on to the end for further discussion. So if that's okay, I'd love to get to Jody's quick question and Nick's quick question, and then we'll continue with the forum. Is that okay, Heidi?
Yeah, I think Chris had said in the past that if there's any issues to email him. And so I think that still stands. And so if we're seeing any burning questions, like across the board and I have access to a lot of social workers, I just wanted to make sure that was still okay.
Of course, Heidi.
Thank you so much. That's it.
Thanks, Heidi. I think, Nick, you had your hand up next.
I think he dropped off.
We'll come back to Nick. Jody?
Yes, I'll ask my question. It's a quick one. The slide you showed, Chris, that showed passive enrollment from January through February, March, April. Was that children only, or was that full passive? With 80% of them? Okay. And 80% of the children are children. Okay.
That was just for the first cohort with children, households with children,
okay,
which was the December 1st mailing.
Do you have a breakdown of, for group one, was it 50% passives? Or do you know, like in the first like 8 months, it's been about 50% passive?
It's been at or above 50%, Jody.
Yeah. So do you think this group was that? So if there were 13,877 in January passives, that's about 50% of the whole group.
Right. But with the households with families was 80%.
Okay. Thank you.
Okay. You're welcome.
Nick, I see you're back.
Sorry, I'm moving my offices, so my audio was unplugged. My question is related to the topic, but not related to the slide, so I can hang back.
Thank you so much. We look forward to bringing your voice to the space during the discussion portion. Thank you all for those questions. We're going to move along to the communications update and the resources that have changed.
Sorry, this was an 11th hour add-on, Kyla.
Oh, my apologies, Christina. I'm sorry.
No problem at all. So I just wanted to speak to, from HealthSource RI's perspective, some of the data that we wanted to share. And this is the latest and greatest. This is not yet on the public dashboard, but is anticipated to be next week. So just a snapshot of those who are transitioning from Medicaid to qualified health plans through HealthSource. It is a busy slide, but what I can break down for you here is the number you see highlighted in the middle of the slide there are that 52% of those who are eligible for QHP with tax credits, that's what APTC stands for, is the Advanced Premium Tax Credit, have enrolled with HealthSource. The other piece of interest is the table at the bottom, which is breaking down those who've enrolled with us and exactly how they're enrolling. And so just some little snippets of information there that I can break down to percentages for you for easier digestion is that if you look under the grand total column, the 2165 that you see auto-enrolled, that's 37% of those who've enrolled with us have come in the door through auto-enrollment. If you recall from previous presentations, auto-enrollment is put through, sorry, I just see a question popping up there. Yes, we do have data by carrier. I don't have it at my fingertips, but if you would follow up with me by email, I'll drop my email in the chat and we'd be happy to get that to you after the fact. So 37% have come in the door through auto enrollment. That's those folks who are under 200% of FPL, the federal poverty level, who we are enrolling automatically with our shared data system. So they come seamlessly from Medicaid onto the HealthSource RI rolls in a silver level plan that was deemed to be kind of broadest and most beneficial for most people. If you look down the next row of that grand total column, the 1652 who are receiving premium assistance, those are folks who have taken active steps to enroll themselves because they did not make that 200 FPL threshold, but they are under 250, which means that they get 2 months of their premiums paid for them, as do the auto enroll folks. And that includes dental premiums. And we've seen a good number somewhere. And again, I don't have that number at my fingertips with the most up to date, but we were over 600 dental enrollments as of last month's data. And then finally, the active enrolled with no state assistance is just over 2,000 there, 2,001. So that's about a third of the enrollments are coming in of their own volition without the state assistance in place. That's not to say that they are not getting the tax credits. They most likely are, because 6 of 7 HealthSource customers as a whole do benefit from the federal tax credits, which are at an all-time high, thanks to federal action around the pandemic and then following through with the Inflation Reduction Act. So all told, we have about 5,800 individuals enrolled in QHPs who've come off of the Medicaid rolls. And again, if there's any substantial questions related to the slide, I'm happy to take them here. But if not, please drop them in the chat or hold them till the end, and I'll be happy to answer them, whether, you know, by email or via chat or live if I can during the question summary at the end. Thank you.
Thank you so much, Christina. I don't see anything in the chat, so I will hand it off to Stephanie Menders for our communications update and resources.
Thanks, Kyla. Hi, everyone. Stephanie Menders from EOHHS Communications here. Next slide, please. I'm going to quickly run through some information that's available on our website, new resources that are available that we're promoting on social media, sending out to schools, childcare, and community organizations, so the request that you help amplify these messages as well. The first is our Medicaid Renewals Communications Toolkit. This is really focused on messages for households with kids, ensuring that they know that the steps that they can take to prepare and what they should be doing once they get their renewal notice in the mail. There are some images in there that you can download in multiple languages. There are some sample social media posts, sample newsletter content, sample robocall script, and sample text messages as well, if that's something that your organization is able to do. So I highly recommend when we send these slides out that you click through these slides just to connect with these resources directly on our website. Next slide, please. Next, I'd like to highlight some new videos that we have available on our website. These were completed in collaboration with the Rhode Island Commission on the Deaf and Hard of Hearing. They are 2 videos in American Sign Language. One outlines 3 key actions that anyone enrolled in Medicaid can do to make sure that they're ready for their renewal and that they stay covered. And the second video linked here is specific for households with kids and what they can do to prepare during this December to April window for renewals. And again, these are available on staycovered.ri.gov. If you go to the tab for community organizations, there's some member education materials there where you can find these. Next slide, please. And I think this is the last slide I'm going to talk about, but we have a new resource available on our website, the Helper's Handbook. Thank you to the Protect Our Healthcare Coalition for developing this handbook. And we were very excited to partner to make sure that the information in here was thorough and as accurate as possible. So we have some examples here of some information that you might find in this handbook, answers to questions like when are renewals happening and who needs to renew? What is a BDN? Are there different ways renewals are happening? What if a person lost coverage and needs medication or services right away? This is linked again on our staycovered.ri.gov website, and just as a helpful and very thorough resource for any of you who may be working directly with the public and have questions that arise about renewals. Next slide, please. And I'll hand it off to Christina again at HSRI to talk a bit about their communications update.
Sure. So this is just for general awareness, not specifically related to Medicaid, but as you are working with your populations out in the community, wanted you to know that right now HealthSource is in our open enrollment phase. So November 1st through January 31st, any eligible Rhode Islander can enroll in coverage through HealthSource without a qualifying life event. Ordinarily throughout the year, as you probably know, you have to have had a loss of coverage, a change in family status, whether through marriage, divorce, birth, etc. Some sort of precipitating event that lets you choose your coverage. Right now, the doors are wide open and we're welcoming all to come in, change their coverage if they're already with us, choose new coverage if they're not. So our advertising and outreach is active throughout the state right now. You'll see us on buses and billboards, and we are out on social media, digital, streaming radio, streaming TV. So here we have just kind of a sampler of what our outdoor and digital pop-up type banners look like. And if we move on to the next slide, and Sierra, whoever is running the deck, if it's Sierra or someone else, if you could just hit the share audio, we'll need to share audio in order to play this back. This is the short video clip that is on our streaming TV and some of our socials.
Creative, relax. Let's stay healthy. Know what matters to us, and that's where HealthSource RI comes in. Here, you can compare health plans and costs, find expert guidance, get new coverage, or replace lost coverage, and see if you qualify for financial help. So, stay active, connected, and stay healthy. Enroll by December 23rd. Find a plan at healthsourceri.com.
So just to note, you will notice that version says enroll by December 23rd. That's what we're encouraging at the moment for folks to have their coverage active for January 1st. Excuse me, and right before or immediately after January 23rd, you'll see our assets start to flip over to aim folks towards that January 31st deadline, where they can still enroll in coverage, but any enrollments done in the month of January would be for February 1st active coverage. So again, you know, our outreach efforts are active too. We have an outreach team who is out putting collateral into storefronts. We have over 500 locations where they're doing collateral drops. Of note too is that they do have some of the Medicaid materials in hand. So as they're dropping HealthSource materials, they're also posting Medicaid flyers as well in convenience stores, bodegas, hair salons and barber shops, pharmacies throughout the most targeted zip codes where we know folks tend to be uninsured. Those also overlap with the highest zip codes of Medicaid enrollments. So it's really a nice partnership that we're able to offer there. Again, any questions I'm happy to take. And if not, we will kick it over to the next slide.
Thanks so much, Christina. It doesn't look like we have any questions in the chat, so we'll head over to give you a quick update about some new engagement, next steps, and reminders. Next slide, please. EOHHS has added a new Medicaid Renewal outreach specialist. Her name is Melinda May Howard, and she's our outreach coordinator. I apologize for the role confusion. She is a wonderful addition to our staff. She has got a lot of experience making sure that she can get out into the community and run communication efforts. And so I look forward to introducing her to folks around town, along with some of our other partners in the Secretariat. And you can read a little bit more about her. This deck will be shared with all of you after this session. Next slide, please. So now I'm going to hand it over to Rhode Island Health Center Association partners. I believe Joshua is on the call with us today. So I'd love to allow him to provide some updates from his office.
Good morning, everyone. As Christina stated, we are open enrollment period. So that means all hands on deck. If you would like to become an organization, would like to become a certified application counselor, my email is on the screen. Feel free to email me directly, and I can send you the application and some information on how to become a certified application counselor. Another thing is every week during open enrollment, we are having two virtual open enrollment sessions. This week it was the 12th and the 14th. Next week will be the 19th and the 20th. And every week we will have two open enrollment for customers to sign up and get some support from our navigators. The info session on the 20th will be in Spanish. So if we have any Spanish clientele that will need help, feel free to have them sign in and see the info session in Spanish. And last but not least is a new program, Mobile Assister program that we're gonna kick in, and I'm gonna have Kathy talk about that.
Great, Josh. Do you want me to jump in with that now?
Yes.
Okay.
Well, I mean, do you have a slide for that?
I don't know if I don't know if we have a slide. Absolutely happy to talk about it. But
yeah.
Why don't I just jump in with it right now then?
All right, sounds good. I just know that you mentioned you wanted to jump in and talk about that, so.
Sure, because we're very excited about it. Hi, everybody. I'm Kathy Mazza. I'm with HealthSource Rhode Island, and I have oversight responsibility for the contact center for HealthSource and the relationship we enjoy with RICA, who manages our navigator network. And I think all of you know that the contact center for HealthSource not only takes calls from people looking to enroll in HealthSource QHP programs, qualified health programs, but we also take the majority of Medicaid inquiries as well. The Mobile Assister program is something that came about largely because of a lot of input from people around this virtual table. And it is in response to the need for more people out in the community to help particularly Medicaid enrollees keep their Medicaid or come to us and ask questions about their Medicaid. So what we are doing, we partnered with RICA, who again works with us so closely on the Navigator program. And we asked them if they could train and deploy additional navigators in response to requests from folks in the community for us to go out and be at various events and community activities. So that program is formally kicking off in January. We may, and I emphasize it's only may have some capacity to help if there are meetings in the next 2 weeks. But the program will basically allow us to get a team of 2 people out for any event or activity where we're not otherwise having a presence. And that program will last through the spring. So we're hoping that if there is a need, we can now meet that. I will look for any questions in the chat. Josh, do you have anything else you want to cover? Because I do have a couple of things I wanted to share with the group on the contact center, but I don't want to cut off anything else you wanted to share on RICA.
No, that's why I left the Mobile Assister till the end. So no, I'm all set here. If anyone, as I mentioned, if anyone has questions in regards to the CAC program and how to sign up, all hands on deck right now during open enrollment, feel free to email me and I can get you some information.
Great. And now you know why Joshua is one of my favorite people. The expertise that Josh and Shelley over at RICA provide is unparalleled, and we are so pleased to be able to partner with them and have their talents and expertise shared with all of you as you help Rhode Islanders. Just a couple of other quick things that I asked Kyla if I could share with this group today. Go, Rika, yes. During open enrollment for qualified health plan season, we are generally open till 7 p.m. instead of 6 p.m. for the 3 months of November, December, and January. This year, we decided to do something a little different. We were getting extremely few calls between 6 and 7 when we were open. But we've done surveys and we were told by people that it would be great if we were open one late night per week. So instead of being open Monday through Friday till 7 during open enrollment, we're open till 6 Monday, Wednesday through Friday, and now we're open till 9 p.m. on Tuesday. So we're really giving a good window of opportunity for people who work during the traditional workday and want to be able to reach out to us. During open enrollment, we are also open 9 to 12 on Saturdays. We've done that in the past, and we will continue to do that in this current open enrollment and in future ones as well. One of the things that we are doing Tuesday nights, however, that we think will be of interest to this group is if call volume allows us to do so, we are making outbound calls to everyone who has been terminated from Medicaid to say to them, and this is what we call an auto dial. So it's an automated message. We are saying, you know, hi, this is Health Source and Rhode Island Medicaid calling. We are calling just to make sure you are aware that you have been termed. And if you agree with this, you know about it and everything is fine, you can disregard this message. But if for any reason this is a surprise to you, or you need help finding additional coverage, or you have any questions, push blank now, and you can automatically be connected to a rep right now, right during this call. So we're doing that outbound outreach to make sure that nobody has fallen through the cracks. And we've been doing it for the last 3 or 4 Tuesdays. And for the most part, we are finding that people who do press that number to speak to us right away are acknowledging that they know about the termination, but they're asking for help in getting some additional coverage. We have had a few people who are saying they're surprised. We immediately check to see if we have their current address. But regardless, our job is to help them. So if we can get them back in Medicaid, we get them back in Medicaid. But that outbound outreach is happening on Tuesday nights. We'll also do it during the day when our phone volume is light enough to do it. So we're hoping that that catches anybody from falling through the crack. The other thing that I did want to let you all know is our service level agreement with our contact center vendor is to pick up the phone within 3 minutes on average, Tuesday through Saturday, and within 5 minutes on Mondays. Mondays are always our very busiest day. For the most part, we meet those service levels. We have, however, had several days where the average wait time is between 7 and 9 minutes. Now, yesterday it was 1 minute, 10 seconds. So some days we're well under the service level, but we have gone over it. We just ask everybody to be patient with us. Last thing I'm going to mention is our on-site service center is very unfortunately in East Providence. And I think you guys all know East Providence is not a good place to be right now. So if somebody has called us to make an in-person appointment with us, Health Source, we are reaching out to them, calling them and saying, would you prefer a scheduled phone appointment instead? We will look at this situation in the next couple of days, potentially come to another decision about how we can best help people as we all deal with this bridge closure. But for right now, for the immediate next couple of days, we are reaching out to everybody, asking if they would rather be on the phone with us. And with that, I will stop talking. If there are any questions, happy to take them. Let's see. Do you, Deb Burton, I see your hand raised. Do you want to ask a question?
I do. Thank you so much, Kathy. I think the Mobile Assisters program is wonderful. Will you, what kinds of locations are you envisioning being able to go to? For example, will you be able to come out to the senior centers? Part of that question is, did the certified application counselor training become modified so that individuals can assist our older adults who may actually be applying to be duals? And then a third question, which may or may not fit in this venue, is there a green printout? I'm aware that a lot of folks are being referred to HSRI website to apply for LTSS, Home and Community-Based Services Medicaid. And many of our older adults may or may not necessarily be tech savvy, so they'll be turning to the community-based organizations. Are there screenshots of what each one of those screens representing the 42-page LTSS application looks like? So I know that's a lot of questions.
You know, that is a lot of questions, and I can probably focus on one at a time. You may have to repeat. Yep. But the one that I heard that I can kind of address quickly is, we are happy to assist duals or people who will be eligible for dual coverage. So if we were invited to a senior center and we thought there was reason to believe that there are going to be dual eligibles, we would want to work with that request. With that said, I do need to emphasize that our team is not trained or charged with regular Medicare. So it would really be a conversation with whomever is requesting our presence to see what that balance is. Does it make sense to send somebody out there? On the green sheet, I am not familiar. I have a vague understanding of what that is. So I don't think that Health Source really has a lot to do with that. I'm going to ask that question. If you want to send it to me, at the very least, Deb, I can get you to the right person. I can't address it unless there's another state person on the call who can volunteer to jump in on that one. I'm not proficient in that.
Kathy? LTSS application process on HSRI?
No, I don't believe so.
And I don't know if any of my colleagues have a better answer than I, but Kathy, in terms of, LTSS, and I apologize because I got distracted for a minute, but I think the question was, can HSRI help with the LTSS apps? And I think the issue is that that's not what HSRI does. They do Magi. So we don't have a DHS person on the line. We can take that back though to DHS to see who we basically have been saying, go to your trusted partners, and try to get help from like your case management agencies or even providers that could potentially help you. But I don't believe there's anything in place to help people. I don't know. Kyla and Stephanie, you may know differently, but to help with LTSS apps per se.
Right. So our navigators and our certified application counselors are not
Right.
trained to help
Right.
duals. Those individuals would need to sit down with a SHIP counselor.
Right.
They're the ones who are trained. So we always, whenever me as a navigator, I've been a navigator for about 10 years now. Whenever I have so much knowledge in regards to Magi, non-Magi, LTSS because of my history. But I always refer them over to the point because they're the ones who are trained to provide that information. They're the ones who are certified as duals. So.
And Joshua, that's excellent. And that's what I was going to say. I know, and we've talked about this in previous meetings, Kathy's team as well is aware that if someone's asking about Medicare and, duals and, what D-SNPs or what's available to them, the answer is to refer to the point or a SHIP counselor. So we all are doing that. I don't know if if any of us know if the SHIP counselors have been getting, many referrals because of this or not. I don't know. And I don't know about the percentage of LTSS folks who are passively renewed versus active. So again, that's going to eliminate some of the issues, but the active renewals, I'm not sure if the SHIP counselors are seeing that increase.
And I can confirm that when we do these open enrollments, we do come across a lot of duals and elderly folks. Me and Shelly refer them specifically over to the point. We have a contact person over at the point that will email their information so that way they can get in touch with them and help them out in that way. So we do our due diligence in helping them out whenever we come across them.
Okay, I can follow up with you guys offline, but there was a meeting that specifically said that if you are an individual who would like to fill out the application for long-term services and supports, it can be done on the Health Source Rhode Island page, but we can have that conversation separately. I think that the need out there is pretty big, and we can all, many hands make the load light. So I appreciate your response. Thank you.
Great.
Thank you for that dialogue. It's a great topic to bring up, and I'll see if we can invite Christina Anderson, who is the director. She's there. There's Christina.
Hi.
Christina, do you want to add to this conversation?
Yeah, I did want to comment that we have been getting a ton of calls from Health Source to help dual beneficiaries. So you can continue to contact Office of Healthy Aging for that assistance, or the point, because they are our partners for SHIP counseling as well. We also do have 11 partners total throughout Rhode Island that help with SHIP counseling. So if it's helpful, I can provide that information in the chat for anyone that needs that.
Thanks, Christine. I did add your link to the chat, and would you mind introducing yourself?
Hi, everyone. My name is Christine Anderson. I am the SHIP director for the Office of Healthy Aging. I've been in this role for, I don't know, probably like 5 years now. So our role is just to help Medicare beneficiaries and specifically dual beneficiaries with their Medicare options. We just hit our busiest time of the year, which was open enrollment, which was through October 15th through December 7th. But our services are available all year round.
Thank you so much. And for those of you who did not know, you also heard from Lisa DeMuro, the Assistant Medicaid Director. Heidi, I see that you have a question. Thank you so much, Christine, for being here with us, and thank you for chiming in. Heidi, I see you have a question. Do you want to ask that now?
Sure. I just wanted to say to Kathy, that's amazing to hear about this outreach. Did you put an email so we can, or how do you want us to reach you to request the outreach mobile team?
The point of contact is likely going to be Melinda Howard, who
Oh, okay.
you saw a slide on just a little earlier.
Yeah.
We are finalizing right now, Heidi, how we want that point of contact to work. So if you will just bear with us, give us a couple of days to get that out there to you, we'll be able to do it. If you have an urgent need that you know about right now, you could reach me and I'll figure it out for you. But it's the key people that are going to be involved in this will be Melinda Howard and Lisa DeMoro. Kyla will also be involved in a not supervisory, in an oversight type of role. But we'll get to everybody that we possibly can.
And just really quickly, when people are calling, they're usually in despair. Or I love that you guys are calling. It must be an automated notification you're getting that people have been dropped from Medicaid for whatever reason, and that you're calling out to them. I think that's incredibly amazing. If you can reach the people, that's great. Are many of them in despair, like saying, with this now, I can't afford my rent, I can't afford food, stuff like that? And then are you able to refer them to a place?
You know, I look at the call sheets after every Tuesday to find the people that, for whatever reason, I call it having trouble breathing, meaning they're so uptight, they can't take a deep breath, they're upset, and it's our job to get to those people and figure out how to help them. We aren't seeing that. Amazingly, surprisingly, we aren't seeing that. When we have somebody who is struggling, we absolutely do everything we can. Remember, the bottom line is when people have financial difficulties, we now have quite a bit of federal aid to provide them by way of tax credits if they are higher low income, or no cost Medicaid if they are really low income or no income. So the difficulty that our reps report, frankly, is I was able to help them with their medical, but I had to refer them for fuel assistance, or I had to refer them for SNAP, because, you know, those are programs that we can't assist with. But on the medical front, there just seems like for the vast majority of people, we have the ability to give them the support they need. Yes, we're very happy.
Thanks so much, Kathy. Thank you for sharing those safety nets that RICA is providing and being here to answer questions. We really, really appreciate it, and we hope to have you back again. We are reaching the end of our Medicaid Community Advocate Forum. So I want to just reinforce on this next slide ways that you can continue to support this effort out in the community. One of the ways is that there is a Medicaid and CHIP renewals webinar series that talks about what to know and how to prepare. It's a partner education monthly series. So we invite you to take advantage of that resource that's out in the community. And we will head to the next slide, where we're just going to continue to reinforce the ways in which you can help. And that's to continue to spread the message about being ready and staying covered, visiting the website staycoveredri.gov to download any educational materials or any media materials that you can share on your websites and through your social channels. You are our community champions. People go directly to different community providers to get the answers that they need. So please share that information on your social media sites. We know that you are those trusted community champions, and people will listen to your messages. So please continue to do that. We also have, we also want to just continue to champion those messages. So households with kids will have gotten their renewals starting in December, and that will go on until April 2024. Please continue to ask people to update their information now and sign up for text alerts. Continue to ask them to watch the mail for any yellow or green notices from the state. Remind people to open up their mail. It's not a scary thing because they have you as partners to help them get through it. Dependents, please know that dependents may still be eligible for Medicaid even if their parent or guardian isn't available. And on our website, you'll see how there is help that is available to you. You'll also find that on our HSRI website, as well as the supports that you can access from RICA. This will be happening every year, so we continue. We are so thankful for this partnership. We continue to be here to field questions and to work with each other. So thank you for all the dialogue. I see Kathy has a comment, so I want to open the floor to her, and then we'll start the dialogue with the remaining minutes that we have left. Kathy?
Sure. It just occurred to me, Kyla, that I don't think we've promoted something we do every month. And that is once the packets go out, we call everyone to say, we just sent you a packet. If you didn't receive it, please call us. So it is yet another tool in our arsenal to really get the word out there. And I apologize for not mentioning that earlier. Thank you.
Thank you, Kathy. Anyone else have any comments or questions? Start off the comments. Oh, I'm sorry.
Sorry, I was just going to flag Heidi had a question in the chat that some other folks might have as well about the planning of another DHS field office in Providence at Holden Street. So I just want to flag for everybody that I did put some information. I don't have a firm date for when that office is opening, but I know it'll be announced soon. And I put some information in the chat about the different services that will be available there. And as a reminder, Sierra will be following up as well, hopefully before the end of the week or early next week with some Q&As that were discussed during this meeting, including those details.
Thanks, Stephanie. While we have our partners on the line, are there any updates that any of our partners want to provide? Has anyone extended their hours or changed their Medicaid renewal processing dates and spaces? Are there any not updates, but are there any events that are coming up that we should share here during the holidays where outreach will be taking place that we want to all be aware of? Any of that information, feel free to share it here along with any other questions that you may have.
I just wanted to come off mute for a moment just to acknowledge that Deb followed up in the chat with her question about that green form that she was posing to Kathy, and I answered to the extent of my abilities, but maybe there's somebody who can better expand on it. So it looks as though the link she's referring to is within Healthy Road, which I explained briefly. Healthy Road is the shared application and customer service management system of HSRI and the DHS programs. So folks coming in, whether it's for SNAP or cash assistance or medical coverage, be it Medicaid or QHP, they're all funneling into Healthy Road. And so HealthSource RI isn't the owner of that per se. We sort of co-own it with DHS programs as well. So Deb, I see you followed up and said it was a HealthSource link that they put in the chat. So there are multiple entry points to that Healthy Road portal, but there are elements of it that do not belong to HealthSource RI. So I hope that helps clarify some.
Very much. Thank you so much.
No problem.
So I don't see any hands raised, and I don't see any additional questions in the chat. And I know that we're all running from Zoom to Zoom, so I'm happy to give you back 4 minutes before your next meeting. And I still see no hands. Happy holidays, everyone. Thank you so much for your partnership. And we look forward to seeing you back in January.
Great. Thanks, folks.